Hello and welcome to all Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I have a very special guest with me. It's Sejal Fichadia. Hi, Sejal.
Hi, Kristen.
Well,
How are you?
welcome back to Gold. It's so good to
Thank
have you
you.
back here.
Thank you.
Um, you are back with yet another wonderful presentation here, this time for the Gold Neonatal Online Conference. Your presentation title is Parent Touch as a Therapeutic Tool for Pain Management in the NICU. Fascinating topic. It's such a beautiful way to address pain management. But before we jump into that, tell us a little bit about your background and where you
Mhm.
are in the world.
Sure. So I currently reside in Hillsboro, Oregon, United States of America, and I am a lactation consultant and a postpartum doula, and I also am an infant massage educator. And I wear different hats at different times. And today, I'm kind of wearing the hat of the infant massage education professional to talk about the topic at hand.
So tell me a little bit about what inspired your interest in exploring infant massage as a pain management tool for in the NICU setting?
hmm So, even though I don't work in the NICU, when I was doing a lot of postpartum doula work with my clients and families, I could see how stressed they were with, their babies being in the NICU, being so far away from their babies, and they would be constantly, kind of shuffling themselves back and forth between the hospital and home. And I found that just teaching them some simple infant massage techniques that they can bring to the NICU would help them just kind of have that time with their babies where they're just providing some sort of opportunity to touch their babies and also connect with their babies. And as human beings, we are meant to connect with each other. And I find that infant massage just fits that bill so beautifully, specifically if there is distance, a physical distance created due to some medical need, that distance can create a lot of stress in infants and parents. And how do we buffer that stress? That's where my interest in, kind of pain management in the NICU comes from. And I think that all babies would benefit from baby massage. I grew up with infant massage in India. I saw my siblings getting massages. I saw my cousins getting massages. I massaged my own cousins when they were babies. So those are the things that kind of bring me closer to infant massage for not just NICU babies, but all babies.
All babies. Sounds absolutely beautiful. Tell me, is this very common in India, infant massage, or was it just your family was very interested in it and doing it?
It is a very common thing. Most mothers and babies that um, are born, they receive massage every day uh, for the first 40 to 50 days of their postpartum journey. And I think it's such a privilege to, be able to offer that
Mm.
to parents and their infants. And then eventually the moms will take over the massage part. In the
Mhm.
beginning, either it's the grandmother who is massaging the baby, or an auntie, or even a lady who specializes in just giving massages to moms and babies. And
Mm.
they don't have a lot of certifications, but they have worked with their hands and
Yeah.
have helped babies for so long.
For so long. And it's
Yeah,
probably a skill that has been passed down from generation to
exactly.
generation, right? So that's beautiful. And what a nice
Yes.
tool, as you mentioned, to connect and bond with a baby, especially in the NICU with the kind of distance there. The baby is, often hooked up to machines or there's some
hmm
medical needs that need to be met. And for parents,
Yep.
this is a very stressful time, as you mentioned, and they feel like often this is not their baby, right? Like this
hmm
is the hospital's baby. The nurses are taking care of it, the doctors are taking care of it, and they feel kind of helpless.
hmm
But the massage is a way also to bond, to parent, really to be a parent, to have that closeness and bridge that gap, as you so
hmm
wonderfully mentioned that. Yeah, absolutely, absolutely.
Yes.
Um, Tell us a little bit, what do you know about the research? What is the research telling us about the effectiveness as from infant massage for pain relief in the NICU?
Mhm. So more and more research is coming up into what infant massage is doing for these infants that are either in the NICU for, being premature or being sick. And what we are seeing in research is that these interventions are non-pharmacologic, and it gives not only the parents a window into their baby's day to day while they are in the, neonatal intensive care, but also it educates them into reading their infant's cues, helping them, understand, like, how does my baby communicate? Also, we have seen from a lot of research from Dr. Tiffany Field that infants or premature infants that were massaged had a better weight gain. Their
Mm,
bilirubin levels were much better, so they were able to get discharged from the hospital sooner if they were massaged. And the skin being the largest organ of our body,
yeah,
what better way to deliver
yeah.
nutrition through touch? And also, you know these parents who are in this fight or flight state also kind of are coming down from that place and have some authority and
Yeah.
some autonomy in the
Yes.
process of caring for their infants. And like you told just now that it's the hospital's baby, or
Mhm.
and that's not actually the case. It is the
Right.
parent's baby, right?
Of
So
course.
part of the dynamic that we are seeing is that we want to humanize neonatal care as much as
Mhm.
we can. Yeah.
Absolutely. And I can also see what you mentioned there when you mentioned the parents, how beneficial that is for them. It's also
Hmm.
probably good for oxytocin levels,
Yep.
flowing there for baby
Yes.
and parents. And yeah, it is just a wonderful thing. And we know how important touch is because we know from the orphans who grew up in facilities and were never touched how detrimental that was for their
Hmm.
development. And if a baby in the NICU is hooked to machines and is in an incubator or whatever it is, or like for a long period of time and does not experience touch, so we can understand how beneficial touch is. Do you know if there's a difference between if a physician or a nurse massages the baby or the parents, or is that not studied at all, or doesn't it make a difference?
So there is some research, but what we want for neonates
Yes.
specifically is the parents to do the massage, because neonates will connect and communicate with their parent the most.
Hmm.
Of course, an occupational therapist or a physical therapist would be the right person to teach infant massage in the NICU setting, because it's very specific modifications that need to be done for preterm infants that are not very stable. So if a preterm infant is medically otherwise stable, all of the massage that I teach in my classes can be implemented in like their daily routine. But if a
Hmm.
parent is, not very confident, and none of
Yeah.
us are, right? When we're
No,
new
no, of
parents,
course not.
we are all kind of afraid and
Yeah.
concerned about what if we do something wrong,
Yeah.
and if we start teaching this from the beginning in the hospital setting, then that continues when they are discharged and go home, right?
Hmm.
So, usually physicians don't have a lot of time to massage
Correct.
babies in general because they're doing other care for the baby. But sometimes the OT or PT will come in, or even a licensed massage therapist will come in, and kind of show the massage, and then the
Yeah.
parent will do the massage, or even help move the parent's hand on the baby's skin in kind of understanding the gradation of pressure, or how long to do it for. And I'm going to talk in detail about what they kind of do and show some videos as well in the presentation.
Beautiful. Well, that will be wonderful. Can't wait for that. Before I let you go here today, Sejal, if you had a magic wand and you would wave it around, what would you hope would happen? What would you like to see happening in the next 5 years in the NICU setting with regards to this kind of pain management?
um I think underestimating infant pain has been done for so long that we need to move away from that idea, number
Hmm.
one. And that one thing to help the infant, if even if it is a small thing like infant massage, even if it is a small thing like, facilitated tucking, or, just rocking the baby. There are NICU cuddlers now, which is
Yeah.
awesome, but not all facilities have access to everything that is available to like people in the Western civilizations, where more developed countries, right? So,
Mhm.
how can we bring this information to every place where there are neonates,
Mhm.
and premature infants need that um, care, that level
Yeah.
of care everywhere, not just in developed nations, but every nation should
Everywhere.
have that. And parents are really, truly grateful for the opportunity to learn from you.
Mhm. Wonderful.
Yeah.
Well, Sejal, thank you so much for being here with me today, and I'm looking so much forward to your presentation here at Gold.
Thank you, Kristen.
And now some information for our viewers. This presentation, the Parent Touch as a Therapeutic Tool for Pain Management in the NICU. This presentation is part of the add-on package, Effective Pain Relief in the NICU, Tools and Techniques for Neonatal Comfort, which is right now the add-on package for our Gold Neonatal online conference. The conference starts June 3rd, and we have a free and open access keynote presentation available. You can find out how to sign up for that and for the conference and all the other wonderful presentations in the conference and the add-on package when you go to goldneonatal.com. And I hope to see everyone at the conference. Bye-bye, everyone.